Hi everyone, my name is Rachel Abar, and I'm here to talk about my literature review that I've been working on for the past 8 weeks. My topic of choice was personality disorders and treatment plans, and I focused on borderline personality disorder. A little background on borderline personality disorder is it's a condition characterized by difficulties in regulating emotion. This difficulty leads to severe, unstable mood swings, impulsivity, instability, poor self image, and stormy personal relationships. People may make repeated attempts to avoid real or imagined situations of abandonment. The combined result of living with borderline personality disorder can manifest into destructive behavior, such as self harming or suicide attempts. It is estimated that 1.6% of adults in the US population have borderline personality disorder, but it may be as high as 5.9%. Nearly 75% of people diagnosed with borderline personality disorder are women, but recent research suggests that men may be also frequently affected with borderline personality disorder. In the past, men with borderline personality disorder were often misdiagnosed with PTSD or depression. Some of the symptoms of borderline personality disorder are as follows: frantic efforts to avoid being abandoned by friends and family, unstable personal relationships that alternate between idolization, distorted and unstable self image, which affects moods, values, opinions, goals, and relationships, impulsive behaviors that can have dangerous outcomes, such as excessive spending, unsafe sex, substance abuse, or reckless driving, suicidal and self harming behavior, periods of intense depressed mood, irritability, or anxiety lasting a few hours and even a few days, chronic feelings of boredom and emptiness, inappropriate, intense, and uncontrollable anger, often followed by shame and guilt, dissociative feelings, disconnecting from your thoughts or sense of identity, an out of body type of feeling, stress related paranoid thoughts. Severe cases of stress can also lead to brief psychotic episodes. Borderline personality disorder is ultimately characterized by the emotional turmoil it causes. People who have it feel emotions intensely and for long periods of time. It is harder for them to return to stable baseline after an emotionally intense event. Suicide threats and attempts are very common for people with borderline personality disorder. Self harming acts such as cutting and burning are also common. The causes of borderline personality disorder are not fully understood, but scientists agree that it is a result of the combination of factors. One, it's genetics. While no specific gene has been shown to directly cause borderline personality disorder, studies in twins suggest that illness has strong hereditary links. Borderline personality disorder is about 5 times more common among people who have the first degree relative with the disorder. Environmental factors. People who experience traumatic life events such as physical or sexual abuse during childhood or neglect and separation from parents are at increased risk of borderline personality disorder. Brain function. The way the brain works is often different in people with borderline personality disorder, suggesting that there is a neurological basis for some of the symptoms, specifically the portions of the brain that control emotion and decision making. Judgment may not communicate well with one another. Borderline personality disorder, one of the many personality disorders. A little information to note is that they engage negatively with staff and have a bad reputation, create unconsciously hostility and violence, hurt themselves, threaten to suicide, antagonize the staff, drop out of treatment, and even sue their therapist. They are perceived as difficult, annoying, manipulative, and as bad and not ill. As to what treatments might work, well, some of the treatments I have researched are hospitalization with treatment, medication, dialectical behavioral therapy, which is a form of psychotherapy but has been proven to be effective with clients who are diagnosed with borderline personality disorder. Dialectical behavioral therapy was designed to help clients who were very suicidal and have emotional dysregulation. I researched an article by Biskin in Paris. The authors discussed a study that was conducted to test the theory that dialectical behavioral therapy is the best effective psychotherapy to treat borderline personality disorder. The study compared DBT with community treatment. After a year, those clients who were being treated with DBT showed improvements in the amount of suicidal behaviors and less days as an inpatient. They also found that clients stayed in treatment longer than those who were treated with community treatments. In addition to DBT, hospitalization accompanied by mental health treatment has also been an option for treatment. I researched an article Bateman had written discussing treatment comparisons to hospitalization. His colleagues found that there was a decrease in symptoms and treatment were working effectively after about 18 weeks of partial hospitalization. Medication is a form of treatment for clients with borderline personality disorder. Doctors, psychiatrists, and therapists sometimes not all the time, have to medicate clients because an article I researched had concluded that there may be a role for mood stabilizers and antipsychotics in treating some symptoms found in this condition. Medication are often instrumental to treatment plan. There isn't just one specific med that helps borderline personality disorder. There are several that can be used to treat the rest of the symptoms. Another way that we can make all treatment succeed is that staff have the right attitude and mentality to work with such complex mental illness. According to Cohen, because attitudes influence treatment outcome, it is crucial that all type of healthcare workers set aside their negative attitudes while working on their treatment. This topic affects the delivery of human services because this is very common and difficult mental illness to work with. Knowing as much as you can before you start working with clients diagnosed with borderline personality disorder will make it that much easier for your work. This topic was important to me because I was struggling with my client who was diagnosed with borderline personality disorder. I wanted to get to know more about this mental illness and what I can do to contribute to a positive recovery for her. I wanted to use different treatment options so that my job can be just a little bit easier for me. And this is my research paper and my literature review. Hope you enjoyed that little information about it. Thank you.